People often ask me,
what should I take on my trip, Dr. Madge? Do you need any prescription or over-the-counter medications in case of medical illnesses?
I wanted to dedicate this episode to the items that I personally take along with me as a physician on our family trips in order to be well prepared for common travel-related illnesses, conditions that I see and treat all the time in my practice. Towards the last part of the video, I will also add what to take if you're traveling internationally, and we'll review the best masks and how to make certain that yours is not a counterfeit, something that I've seen a lot. Just like your upcoming flight, you don't want to miss this. If it's your first time here, I'm Dr. Madge. Consider subscribing to this channel for up-to-date medical topics and headlines. Please note that this video is not sponsored in any way, and the recommendations that I'm making here in this video are truly just for your own benefit and nothing else. First of all, antacids, especially useful if you are prone to heartburn or acid reflux, which is super common. But new foods like spices and flavors that you're not used to can actually induce symptoms for anyone. The category of acid reducers that omeprazole belongs to, which are the proton pump inhibitors, are stronger but may take a few days to kick in. But the weaker H2 blockers, such as famotidine, ranitidine, are shorter acting and more quick to provide relief. So both can actually be taken simultaneously if symptoms are severe or persistent enough, and they are all over the counter and available as a low-cost generic. The second thing I take are antihistamines. If you're prone to allergies like I am, non-drowsy over-the-counter loratadine, cetirizine, or fexofenadine may be useful in case of, sneezing, itchy, watery eyes, runny nose, or even hives if you're prone. You may find yourself in a potentially unfamiliar environment, and it really pays to be prepared just in case. Note that diphenhydramine, which is the generic for Benadryl, is more potent, but it causes drowsiness and is shorter acting. Pain and fever reducers. Note that acetaminophen does not require food intake, but ibuprofen actually does because it can irritate the stomach lining if it's taken on an empty stomach, just FYI. And don't forget to take the liquid version along for your children as well. Next, hydrocortisone 1%, which is over the counter. This is a cream that's useful for itching or rashes, like think insect bites or poison ivy or eczema. Stronger steroid prescription topicals can also be useful and used in lieu of the hydrocortisone, but their use should be avoided on the face and in the groin because the steroid creams can actually cause skin thinning, and those are some of the thinnest skin on your body already. Next, motion sickness medication. An example is over-the-counter Dramamine. Scopolamine is a prescription alternative, a small patch placed behind the ear and left for 72 hours. It may be more useful for like cruise ships and not really short duration activities. Ziplining, anyone? My husband and my kids made me do this, and I will never forgive them. I'll get you guys back. Disinfectant wipes, perhaps short of being obsessive compulsive, I do admit. I do purchase travel disinfectant wipes and wipe up all the surfaces when entering a hotel room. Yes, I do. This includes like countertops, tabletops, light switches, remote controls, doorknobs, the safe control buttons, the shower surfaces, and of course the toilet surfaces and the knobs. Yuck. You can never be certain how well the room was disinfected prior to your use or who was staying in the room prior. I mean, it's always best to err on the side of caution. Insect repellent. If mosquitoes are rampant at your destination and you tend to be one of those people that tends to attract them, a repellent would be useful. Mosquitoes are one of the most common vectors of disease. The most effective are those containing DEET, and although have not been shown to be harmful in concentrations that are present in over-the-counter products right now, there is some controversy over their use. But DEET concentrations vary from 10 to 75%, and its efficacy plateaus at about 30%. Higher concentrations than this are often unnecessary, so that would be probably the limit that I would personally purchase. Note that DEET can degrade plastic surfaces if coming into contact with it, so be careful where you touch. Yeah. In destinations with low levels of mosquito-borne disease, however, milder repellents may be sufficient, and these include things that contain picaridin, which is a plant-derived compound which is odorless and not greasy like DEET, and second to DEET probably in efficacy, I'd say. Or you can use PMD, which is an ingredient in oil of lemon eucalyptus, which is about half as effective as DEET, I'd say. Other agents marketed as repellents such as citronella and botanical oils and various supplements and electronic devices and repellent bracelets have not been shown to be effective, sorry. A small first aid kit. This includes band-aids of various sizes, and waterproof ones would especially be useful if you're gonna be swimming. Antibiotic ointment, a small antiseptic wound cleanser, and small scissors. Next, sun protection. You can't forget that. Sunscreen with SPF 30 or higher, labeled as specifically containing both UVA and UVB ray protection with either zinc oxide or titanium as the active ingredients, are the most effective. Now, sunscreen's full effectiveness lasts about 2 hours. So if you're gonna be spending time out in the sun longer than that, you really should be reapplying it every 2 hours. Note that various destinations may have sunscreen regulations, and some require reef-safe products such as Hawaii and even some parts of Mexico. Also, don't forget about lip protection with SPF and eye protection like sunglasses with both UVA and UVB protection, and a broad rim hat for further face protection. Long sleeve swimwear and or long sleeve rash guards, especially for children, may also be a wise option. If you are prone to sunburn, you may also want to take along that aloe gel. Hand sanitizer. Now, most well-equipped hotels have this readily available, so I've seen. However, a trial size container for every member of your household may still be useful for other times, like during the traveling process, such as in the airport or on the plane. I typically take one and I attach it to each one of our backpacks. If you're traveling internationally, check out the Center for Disease Control or CDC page for the country that you're visiting as early as possible. And I'll place a link to that website in the description below, because there may be certain vaccine requirements and some of them are spread apart like 6 months or more. And I've seen people not be able to make it in time for prior to their travel. So if you want the most protection, I would try to set that up as early as possible. You also have the option to seek a travel doctor who is well versed in travel requirements and can optimize your health prior to traveling internationally, or you can alternatively seek a travel clinic at a local pharmacy such as Costco. I hear some Costco locations are doing this, and it may be more of an economical choice, as many health plans do not provide travel clinic coverage. Also, don't forget to call your health plan and determine if you even have healthcare coverage when traveling abroad. Learn the details before you go in case of an emergency, because I'm telling you, they happen, and I've seen them happen over and over in my patients. Traveler's diarrhea treatment. You may want to take this when going internationally if it is endemic at your destination. It is important to note, however, that most traveler's diarrhea is still viral and antibiotics are not effective because they only work for bacteria. But bloody diarrhea specifically is more linked to bacterial causes, and I generally advise my patients to avoid using the antibiotics for mild to moderate diarrhea, which is typically self-resolving. Anti-diarrhea medication. Now, over-the-counter loperamide is an example. Again, tolerable diarrhea does not need to be treated and is often left alone. This is one item that I personally don't put in my travel health kit. But if you're prone to diarrhea, like let's say you have irritable bowel syndrome and your doctor deems it safe enough to take, then it is an option. Water purification tablets. Not a lot of people think about this one. Research the water quality of your destination if you're traveling internationally, because bacteria, viruses, and parasites can be transmitted through consuming the water and or ice, or if it's used to prepare your food, or even to brush your teeth. You may boil the water for a full 3 minutes of rolling, or you can take water purification tablets. I'll place a link to the CDC recommendations for more details on this specific topic down in the description. Food poisoning is common with international travel. In general, avoid the consumption of water and ice and opt for cooked food versus raw will lessen your risk of getting sick. I learned this one the hard way on a recent trip to Mexico, so make sure you're prepared because it can happen to anyone. Protective masks. Now, whether you're traveling internationally or not, this is an important one right now in this day and age. N95 respirators are by far the most protective, filtering about 95% of airborne particles in the air, and are the masks that healthcare professionals wear on the job. However, they are by far the most constricting and very difficult to tolerate for most, even adults. Beware of Amazon because counterfeits of N95 masks are rampant. I'll share a link below on how to spot counterfeit masks, along with a list of NIOSH approved masks and known counterfeits. I've seen a lot of these masks worn by my patients in the office. A KN95 respirator, on the other hand, is another option that's been authorized by the CDC as an alternative during the world's PPE shortage. Although their use is still not permitted in the healthcare setting, we are required to wear N95s when there's high exposure. Although better tolerated, they are manufactured in China and may not be as protective. About 60% of KN95 respirators that NIOSH evaluated did not meet the standard requirements, but they are still a very good second choice. If neither N95 or KN95s are accessible or tolerable, then the next best option would be to double mask using a disposable surgical mask first and then a cloth one on top. All of these options are better than just a simple cloth mask, which has been shown to be the least protected. Anything you wish you had taken and realized you needed on your trip, I would love to hear. Share it with us in the comments down below. Well, there you have it. Now you know everything that I take along on my travel health kit for me and my family. If you found the information valuable, which is always my goal, please give it a like and hit that red subscribe button along with that notification bell next to it so that you don't miss any of my future videos. And please feel free to share it with someone who is traveling. Well, thanks for tuning in. Stay travel healthy, and I'll catch you next time.
Take a look at